our chapter 1. The alternation of cause and results. The causes and results can exchange with each other. In the evolution of a disease, primarily the cause of the disease can produce a result. Then this result can also become another cause in the evolution process of disease. And when this going on, it'll produce, or let's say form, a circle. The good circle lead to a good result, good outcome eventually. We call it benign circle. And evil circle, we call it a vicious circle. And local systemic relationship. Diseases are generally systemic, whereas the local pathological alterations caused by insults are recognized to be representative of systemic or systemic diseases. For example, stomach pain can be related to myocardial infarction. Just by a first glance, we may feel these two diseases are from different systems. One belongs to GI system, the other one belongs to cardiovascular system. But as a matter of fact, they are linked with each other closely. Loss of appetite can be related to uremia. So one is kidney failure, and the other one is GI, a common clinical symptoms of GI problems. So we should, after learning all these clinical subjects and basic subjects, for example, like our pathophysiology, we should be able to put this into our mind that there are links between the symptoms, seems unrelated to each other. Outcome of disease. What will be the final outcome? The course of a disease varies. An acute disease has relatively sudden onset. We call it an acute, and lasts for a very short period of time, whereas the chronic disease sometimes begin with an acute phase, usually lasts for a long period of time, turn into a chronic stage. There are generally three types of outcome for a disease. One is completely recovery. We all had this kind of experience. For example, have you ever had a flu? Of course you did. So we call it complete recovery. And there are incomplete recovery. For example, we have a surgical situation, and after it is fixed by a surgery, we have scars, and also we may lose some of the function. We call it incomplete recovery. And the worst one is death. All the injurious factors, all the reasons, one, and we lose our life, death. A complete recovery. This is best outcome of the disease, of course. In this case, the pathological alters metabolism, structure, and function are perfectly restored, and the symptoms and signs of this disease disappear entirely. Incomplete recovery. The main symptoms disappear, but some pathological changes left behind, namely sequelae. Sequelae is generally brought about by the compensatory response to maintain a relatively normal activity. What is death? Death is the cessation of heartbeats and breath. It's used as the criterion of death of a body. And traditionally, death is a process including agno stage, stage of clinical death, stage of biological death. And nowadays, we have a new concept compared with normal or traditional death. We call it brain death. The functions of cerebrum and brainstem stops forever, but the other organs may still functioning with the artificial medical support. And the criteria for brain death are the following: irreversible coma. You can never wake up this patient anymore, even though the body temperature is still there and the heartbeat is still there and the patient is breathing with the help or with the assistance of the breathing machine. Cessation of spontaneous respiration, that's what I just mentioned. Without the help of machine, the patient would not be able to breathe him or herself. Non-purposeful movement. There are movement, but without awareness. Absence of cephalic reflexes. All the reflexes, cephalic reflexes, cannot be induced. Absence of any electric activity of the brain. We can check the electric activity of our heart by ECG. The same we can do to our brain. But when you check it, there is no electric activity in our brain happening. Absence of cerebral circulation. So basically, your brain is dead. Significance of brain death. Why we take so much hassle to make the diagnosis of cerebral death or brain death is because we can determine the exact time of death. You can announce the time of death after you know the brain death has already happened. And also because this death is kind of different. It's absolutely different from the traditional death we always used and decided according to the heartbeat and breathing activity. This is new idea, and the most of the functions are still working. Most of the functions of most of the organs are still there. So at the exact time to announce the brain death, and that this person with the consensus, with the consent of patient, him or herself, or others, relatives, next step can happen. It's helpful to organ transplantation. For example, cornea, kidney, liver, any useful organs for people who are struggling with the failure of this kind of system. Next step, human vegetable. When cerebral function is lost, the reticular activating system and brainstem can maintain a crude waking state known as a vegetative state. The difference from brain death is the human vegetable has simultaneous, a spontaneous respiration. And next step, people will think about euthanasia, because when a person is in the state of being a human vegetable, there's not much hope to bring this patient back to normal state, and It will cause a great financial and physical and psychological torture for the patient's family, and also for those people whose medical cost is paid by the national health system. It's a great burden for the country, for the government too. So euthanasia is a way to let the patient go and use this financial budget to people who can be cured, who can still contribute to the society. But all this can only happen when the patient himself or the relatives agreed according to their own will. We can do this. Without this, we cannot do. And nowadays, only very few countries in this world take this euthanasia as a legal process. And that's all for the introduction chapter of our